Imagine handing over like 2,600 pounds.
Oh, wow.
All
Yeah.
right, just handing it over, lying back in a clinical chair, and having millions of these microscopic text messages injected into your most intimate tissues.
It sounds wild when you put it like that.
It sounds completely like science fiction,
Oh,
but they
man.
promise that it can essentially reverse your biological clock.
hmm
And I mean, it is happening every single day.
It really is. It's actually one of the fastest growing and frankly the most misunderstood sectors in regenerative medicine right now.
Yeah.
The sheer volume of demand for intimate exosome therapy is just staggering. But the gap between the actual clinical reality and, the aggressive online marketing, it's wide enough to drive a truck through.
Exactly. So welcome to this deep dive. Today we're plunging into a topic that honestly for a lot of people still feels a bit taboo to talk about openly.
Sure, absolutely.
But behind closed doors and definitely in search engines, you're desperately looking for solutions to intimate health issues. So our mission for you today is singular and highly specific.
Right, we're focusing on the numbers.
Exactly. We are sifting through a massive, really complex stack of sources. We've got clinical guidelines from the Women's Health Clinic. We've got detailed aesthetic protocols from practices like Dr. Nadia Yousri and La Home Inti Clinic. And importantly, some very severe safety warnings from regulatory bodies like the FDA.
Which are crucial to talk about.
They really are. So we're taking all of that data to answer one highly practical question for you. How many intimate exosome sessions are actually needed to see real, sustained results?
Because if you are going to invest your time, your physical comfort, and, as you mentioned, a significant amount of your money into a regenerative treatment.
Yeah, 2,600 pounds is no joke.
Exactly. You need to know the biological timeline. You have to separate the actual science of cellular repair from those, glossy miracle cure clinic brochures.
Right. So before we can even begin to count the sessions, we need to understand what exactly is being administered to you during these appointments.
Yeah, let's start there.
Because when most of us hear regenerative medicine, we instantly think of stem cells, right?
Oh, absolutely. That's the buzzword.
Right. And we picture stem cells as like the construction workers of the body. They show up at a site of injury to do the heavy lifting and physically build new tissue.
Yeah.
But according to our sources, exosomes are not the workers.
No, they're not. They are the blueprints. Or, to use your analogy, they're the biological text messages that those construction workers send to each other.
Okay.
Exosomes themselves are not living cells. They do not replicate, and they don't multiply once they're inside your body.
Wait, they don't?
No, they don't. They are incredibly tiny, microscopic vesicles, basically just little lipid envelopes, and they carry a very specific payload of proteins, lipids, and genetic material, primarily messenger RNA.
Okay, well, let's unpack this mechanism because the biology here is just wild. How does a tiny lipid envelope actually force a dormant cell in your body to wake up and start repairing tissue?
Well, it comes down to cellular mechanics. The outer shell of an exosome is a lipid bilayer, which is fundamentally the exact same material as the membrane of your own human cells. So when an exosome is injected into intimate tissue, your cells recognize that lipid envelope as friendly.
Oh, like a VIP pass.
Exactly. The exosome literally merges with your cell's membrane and dumps its genetic payload directly into the cell's cytoplasm.
Wow.
Yeah. And then your cell's internal machinery, the ribosomes, they read that messenger RNA like a ticker tape.
Just following the instructions.
Right. They follow the instructions to start manufacturing new collagen, elastin, and specialized proteins. It is effectively a localized hack of your cell's own manufacturing plant.
So it's not adding new cells to the area. It's forcing your existing, maybe, aging or sluggish cells to act young again.
Exactly.
What's fascinating here is how the clinical breakdowns draw a very sharp line between this process and something our listeners might already know about, like PRP.
Yes, platelet-rich plasma.
Right. Because PRP has been the gold standard for intimate rejuvenation for years, right? Like the O shot or the P shot.
It has, yeah. But the contrast here is really critical to understand. With PRP, the clinic draws your own blood, spins it down in a centrifuge to isolate your natural platelets, and injects those growth factors back into your tissue.
Okay.
But the success of PRP relies entirely on the biological quality of your own blood at that exact moment in time.
Oh, I see where this is going.
Right. So if you are, say, 55, chronically stressed, fighting systemic inflammation, and sleep deprived.
Your blood isn't going to be in great shape.
Exactly. Your platelets are going to be exhausted and full of inflammatory markers. You are just recycling your own stressed biology.
Whereas exosomes are lab-derived.
Correct.
They are manufactured off-the-shelf biological messengers extracted from highly controlled, completely pristine environments. They're standardized.
Yes, they are.
So regardless of how stressed or inflamed you are receiving a concentrated dose of optimal signaling. And the sources show clinics using these signals for an incredibly broad range of issues.
Oh, a massive range.
Right. Like, they're being applied to treat severe vaginal dryness, improve clitoral sensitivity, and address female sexual arousal disorder, or FSAD.
And the applications extend to male intimate health as well. Extensive multimodal protocols are being studied and utilized for erectile dysfunction, aiming to regenerate the vascular health and endothelial lining of the penile tissue.
Wow.
Yeah, the entire clinical scope is based on the exosome's ability to signal tissue repair, shut down localized inflammation, and promote angiogenesis.
Which is what exactly?
Angiogenesis is the formation of entirely new blood vessels.
Okay, wait. I have to push back here.
Go for it.
If these are just microscopic text messages that deliver their payload, force the cell to make some collagen, and then quickly degrade, how are clinics getting away with marketing them as a one-stop miracle cure?
Well,
Because, I mean, you scroll through social media and you see these ads promising that a single session will completely resolve complex, deeply rooted issues like FSAD or severe ED. If the biology is based on temporary signaling, how does a single text message fix a systemic long-term problem?
the biological reality is that it cannot. It just can't.
Oh.
The gap between the cellular science and the clinic marketing is vast. Sending one single regenerative signal to a cellular environment that has been exhausted, damaged, or inflamed for years, that is never going to permanently reverse a systemic condition.
Which brings us to the reality of the clinic versus the brochure, and why one session is mathematically the wrong answer.
Right.
The Women's Health Clinic specifically calls this out in their clinical guidelines. They state in plain text that it is a myth that FSAD is solved by one injection.
And calling it a myth is a medically necessary intervention, honestly. Intimate health is deeply multifactorial.
What do you mean by multifactorial in this context?
Well, take female sensitivity and arousal, for instance. It relies on a highly synchronized orchestra of physiological events. You need optimal nerve conductivity, robust localized blood flow, balanced systemic hormones, and proper pelvic floor muscle tone.
That is a lot of different systems.
Exactly. A single injection of exosomes, one isolated payload of regenerative instructions, cannot magically rewire all of those interconnected underlying systems simultaneously.
Right, here's where it gets really interesting. The treatment label is not the diagnosis. Just because a clinic offers an intimate rejuvenation exosome package does not mean that package is the correct answer for your specific symptom.
Absolutely. Proper medical assessment is non-negotiable.
Right.
You cannot simply throw an advanced biological product at a symptom without investigating the root cause of the dysfunction. Like, if vaginal dryness or a sudden lack of sensation is caused by a systemic hormonal crash from menopause, an exosome injection will not balance your endocrine system.
It's not replacing estrogen.
Exactly. And if the issue stems from an underlying dermatological autoimmune condition like lichen sclerosis or even a psychosexual block, the exosome is not a cure.
I mean, it might temporarily soothe the tissue by dumping anti-inflammatory proteins, but it won't solve the underlying deficit. But wait, if I go to the doctor with a bacterial infection, I get a course of antibiotics and the bacteria dies, the problem is solved.
Right.
Why doesn't tissue regeneration work the same way?
Because we are not killing a pathogen here. We are attempting to physically rebuild complex human tissue from the inside out.
Okay.
Think of tissue regeneration like agriculture.
Agriculture.
Yeah. If you have barren, depleted soil, you cannot just throw down seeds once and expect an orchard to grow overnight.
Obviously not.
Right. That first exosome session is essentially preparing the soil. It delivers a massive anti-inflammatory payload that clears out the cellular debris and calms the irritated environment.
Oh, I see.
Then the second session starts laying down the new extracellular matrix, that's planting the seeds.
Right.
And then the subsequent sessions act as the ongoing water and sunlight, really driving the maturation of those new collagen fibers and stabilizing the newly formed blood vessels.
So it's a seasonal harvest, not a microwave dinner.
That's a great way to put it.
You need sustained, repeated signaling to physically change the architecture of the tissue. So having firmly established that the one-and-done approach completely goes against fundamental biology, let's look at the core question of this deep dive.
Let's do it.
What is the actual documented clinical protocol? Like, what is the magic number of sessions you need to book to achieve those real structural changes?
When we cross-reference the clinical protocols in our sources, a very clear, evidence-based consensus emerges. Dr. Nadia Usuri's clinic, which specializes in advanced regenerative gynecology, outlines a standard protocol for treating vaginal atrophy and dryness.
Okay, and what's her recommendation?
Her clinical recommendation is a course of 3 to 4 sessions.
3 to 4 sessions. And the documentation for male intimate treatments tells the exact same story, doesn't it?
It does.
Places like Loma Linda Clinic explicitly state that a course of treatments is required to achieve sustained biological benefits. It is about progressive, compounded improvement. But wait, if you're telling me true structural change takes a full course of treatments, how are these clinics legally claiming that patients feel completely different the morning after one single session?
Well,
Is this just a 650-pound placebo effect? Or is something physical actually happening on day one?
placebo is always a powerful force in any medical intervention, of course. But the initial relief is not purely psychological.
Really?
Yeah, we have to differentiate between the immediate anti-inflammatory response and long-term structural regeneration. When exosomes first merge with your cells, their immediate action is often to release potent anti-inflammatory cytokines.
Okay.
So they rapidly calm down irritated, inflamed tissue and draw initial hydration to the cellular matrix. So you might genuinely feel a rapid reduction in burning or discomfort, and you might notice a slight increase in localized moisture within 24 to 48 hours.
Oh, so you get a quick win. The tissue actually feels calmer. But that is not new collagen.
Precisely. That is symptom management. True structural changes like the neocollagenesis required to thicken resilient vaginal walls and the angiogenesis required for sustained penile hemodynamics, those take significant time.
How much time?
The human body requires a minimum of 4 to 8 weeks to actually develop, cross-link, and mature new collagen fibers and sprout functional new blood vessels.
Which means if you stop after the first session, just because, the burning stopped, you are entirely missing the regenerative window.
You're walking away before the real work is done.
Right. You have to complete the full course of 3 to 4 sessions, usually spaced several weeks apart, to keep compounding those biological text messages until the structural change is actually permanent.
And furthermore, the biological clock never stops ticking. Aging is continuous.
Unfortunately.
Right. Even after completing a 4-session protocol, the clinical sources indicate that maintenance sessions are generally recommended every 6 to 12 weeks. Without ongoing signaling, the tissue will slowly begin to degrade again as part of the natural aging process.
Okay. If the reality of this biology demands 3 to 4 sessions, spaced weeks apart, followed by annual maintenance, we have to talk about what you are actually signing up for here.
We really do.
Because this is a massive financial commitment and, crucially, a significant safety risk. These are entirely out-of-pocket elective procedures.
The financial burden is substantial. None of these regenerative protocols are covered by standard healthcare or insurance policies.
To put real numbers on it, a single exosome session at a specialized practice like Loma Linda starts around 650 pounds.
Right.
So if you are committing to a biological course of 4 sessions, you're looking at 2,600 pounds before you even factor in the cost of annual maintenance. And when you are spending that kind of money to have microscopic biologic material injected or microneedled into highly vascular intimate tissue, you need to be absolutely certain of what is inside that syringe.
You really do, especially because the regulatory environment surrounding exosomes is incredibly volatile and highly scrutinized right now.
Yeah, let's get into that.
In the United States, the FDA is aggressively policing this space. The sources highlight that as of October 2025, the FDA had issued 12 formal warning letters to various exosome manufacturers.
12 federal warning letters for a single category of treatment is alarming. What exactly is the FDA finding in these labs?
The citations are severe. They include marketing unapproved biological products and distributing unlicensed biologics.
Okay.
But the most dangerous violations involve failing to validate sterility and lacking proper manufacturing controls.
Wait, sterility? That's terrifying.
It gets worse. Many exosomes are derived from human sources, such as placental tissue or umbilical cord fluid. If a manufacturer fails to maintain absolute sterility, you run the risk of introducing bacterial contamination or transmitting communicable diseases directly into the bloodstream of a patient.
Oh my.
Yeah, injecting a non-sterile biologic into vascular-rich, intimate tissue can lead to catastrophic systemic infections.
That is terrifying.
Yeah.
Which completely explains why different countries are taking vastly different regulatory approaches. Like, In the UK, the use of human-derived exosomes for any cosmetic or aesthetic purpose is currently illegal.
Yes.
The regulatory bodies just will not allow human donor tissue to be used for elective rejuvenation.
And because of that strict legal barrier, legitimate UK clinics have had to pivot. The clinical materials show that UK practitioners utilize plant-based alternatives.
Wait, plant-based?
Yes. These are bioengineered plant vesicles designed to mimic the signaling functions of human exosomes while fully complying with safety regulations.
Hold on, stop right there. How does a plant fix my human anatomy?
It sounds crazy, I know.
Right. If a patient is dealing with vaginal atrophy or erectile dysfunction, how does injecting a plant extract communicate with human DNA? We are totally different species.
This is where regenerative biology gets truly mind-bending. It relies on something called cross-kingdom cellular communication.
Roskin,
Yeah. Life on Earth shares incredibly deeply conserved biological machinery. The protective lipid bilayer of a plant-derived exosome-like nanovesicle, which is often extracted from resilient plants like Centella asiatica or specific rose stem cells.
okay.
That bilayer is structurally almost identical to a human cell membrane.
So the human body doesn't view the plant envelope as an invader.
Exactly. It recognizes the lipid structure as biologically compatible. The human cell membrane allows the plant vesicle to merge and deliver its payload.
Wow.
And inside that plant vesicle are microRNAs and beneficial lipids that just happen to interact flawlessly with human cellular pathways.
That's wild.
It is. The human macrophage, or fibroblast, consumes the plant vesicle, reads the highly conserved genetic code, and responds by turning down the human inflammatory response and upregulating the human collagen production pathways. A biological text message sent from a plant is successfully read and executed by a human cell.
That is a massive aha moment. The fact that a localized cellular network in human intimate tissue can read the regenerative blueprints of a plant to bypass strict medical regulations is just staggering.
It's brilliant science.
But it also means that as a consumer, you have to be incredibly vigilant. If you are walking into a clinic ready to put down 2,600 pounds for a course of 4 sessions, you must protect yourself from shady suppliers and uneducated practitioners. So we synthesized the clinical warnings into a definitive safety checklist for you.
You need to know exactly what to ask.
Exactly. If you are going to book an exosome consultation, you must ask the practitioner 3 specific questions. Take it away.
First, ask, what is the exact exosome product you use? You need the full brand name and the name of the laboratory that manufactured it. Vague answers like our proprietary blend are completely unacceptable. You need traceable data.
Right. Second, ask, is the product human-derived, plant-based, or animal-derived? If you're sitting in a clinic in the UK and the practitioner tells you they are injecting human-derived exosomes for a cosmetic, intimate treatment, they're operating outside the law, and you need to leave immediately.
Absolutely run. And third, ask, can I see written evidence of sourcing, sterility, and safety data? A reputable medical professional using a regulated, high-quality biological product will have all certificates of analysis readily available.
They shouldn't hide it.
Exactly. They will be eager to demonstrate their compliance. If they hesitate, become defensive, or, just dismiss your concerns, that is your signal to walk away.
So we started this deep dive looking for a concrete number, trying to cut through the noise of aggressive online marketing and those miracle claims. And the clinical data gives us a real answer.
It does.
How many intimate exosome sessions are actually needed to see real sustained tissue regeneration? The biological protocol dictates 3 to 4 sessions.
However, that protocol comes with vital contingencies. It demands a thorough medical assessment to ensure exosomes are actually the appropriate intervention for your specific diagnosis.
Right, rather than a misapplied treatment for an underlying hormonal or autoimmune issue.
Exactly.
The science of cross-kingdom cellular signaling and regenerative medicine holds immense promise for intimate conditions that have historically been brushed aside or deemed too difficult to treat. But you must fiercely protect your time, your wallet, and your biology. Recognize the one-and-done myth for what it is: marketing.
It's just marketing.
And always demand absolute transparency regarding safety and sourcing before committing to a multi-session biological course.
Analyzing how far this technology has come really does force you to consider the future trajectory of medicine.
For sure.
Currently, we rely on lab-derived, off-the-shelf products, sometimes bioengineered from plants, to send generalized healing instructions to our tissues over a series of months. But biotechnology is advancing at an exponential rate.
Where do you see it going?
What happens in the near future when we completely map these signaling pathways? What happens when we gain the ability to synthesize and code our own personalized exosomes?
Like bespoke cellular messengers mapped directly to our own DNA.
Exactly. Imagine a near future where instead of booking 4 sessions of a generic plant-based product, you could just download a specific personalized cellular command.
Wow.
A targeted genetic code designed purely for your unique biological signature, allowing you to reverse localized tissue aging, resolve intimate inflammation, or regenerate vascular networks on demand. You'd essentially bypass generalized traditional medicine entirely.
From struggling with a murky, taboo diagnosis
Yeah,
to literally downloading bespoke biological text messages to regenerate your own intimate tissues.
it's coming.
The landscape of what is medically possible is definitely shifting beneath our feet. Thank you so much for joining us on this deep dive. Keep asking the hard questions, and we will catch you on the next one.